You're watching Medically Speaking on NewsX, and I'm Meenakshi Upreti. With me, a guest who needs no introduction, a renowned physician from the national capital, Dr. Krishnan Chuk. He is the HOD of the pediatric department when we speak of the Fortis chain of hospitals. Good afternoon, sir. Thank you for joining us on NewsX. My very first question to you, we are seeing a large number of students, toddlers and above, who are now falling to coronavirus. They're falling prey to COVID. Remember in NCR itself, sir, last week there were over a dozen students who had tested positive for COVID. Why is it that we are seeing such large number of students who are testing positive for COVID? And how do we save our children from the same, considering they're already attending schools, they're already attending classes, and masks seems to be a thing of the past?
Well, it is true that coronavirus, COVID disease numbers have increased, and especially so in younger children. Not only children, in fact, adults also, but probably more so in children, because they were totally hidden or kind of locked up at homes for months and almost 2 years. Now that they've been released from there and allowed to go to school and interact with their own age group children and maybe many more in the school bus and so on. So it is quite expected that any respiratory infection, be it COVID or even otherwise, others, their numbers will increase. What we have to keep a watch on is the number going really, really very skyrocketing as it happened, let's say 2 months back, when the third wave hit us very badly? Or is it just that numbers have increased, what we can call a surge rather than a wave? The second part would be, what is the severity of this kind of illness? If the illness is not very severe, it is as like any other virus, which can cause a fever of, let's say, 2, 3, 5 days maximum, lead to a lot of cough and runny nose and such symptoms, maybe a little bit of vomiting and diarrhea, and everything can get well at home in majority of children and not need hospitalization, then our worry is not too much. Probably we can continue to open up and continue with schooling the way we're doing right
as of now, since you say that everything boils down to the severity of the disease, as of now, what is the trend that you were seeing? I believe the cases which are coming forward even till now seem to be of mild nature, isn't it?
Yes, generally they are mild. Like, you see, if we go back to, let's say, 2 years back when COVID was not there, and let's talk about schools opening, and around this time, with a new batch of children who have never gone to school, let's say the preschoolers and the nursery children coming, they would get more infections than and what they were having, let's say, previous year before that, or in the previous months. That is quite expected. In the past also, these infections would be severe in a small percentage of children. Rest would take it like any other illness. So similar trend is being followed till now. There are very few who are needing hospitalization.
Okay, but would you say, sir, since you were saying that, whenever children do go to schools, etc., after a gap, you do see, students and children, especially toddlers, up falling sick. But this time around, would you say the fact that children have been sitting home for over 2 years, that has also compromised their immunity? Because reports suggest that it's not just COVID, seasonal, influenza, etc., is also affecting children very badly this time around.
Certainly, you see, we have to understand how children develop immunity. One, let's say they are born with what could be called innate immunity. That will protect them partially to some extent to many, many illnesses, but not to all. And not to a very strong onslaught. Let's say a large inoculum of virus comes and we think, yes, because child is otherwise healthy, he will be able to tolerate it and not develop a disease. This doesn't happen. Very often, when we are interacting with these children are interacting with each other, they pick up a little small amount of virus from their friends, from other colleagues. This virus is not large enough to cause a clinical disease or a severe disease. Causes either a mild illness or what can be called a subclinical infection, which means the virus does go in, it does stimulate the immune system, but not enough to cause a disease. This is how they slowly and slowly over the months and years develop immunity to many, many viruses and bacteria. And that's how when you are a grown-up adult, you don't suffer too many of these illnesses. So that, because they were not exposed to this small inoculum, small infections for past 2 years, it is quite expected that when they go to school and suddenly they are exposed to all this, they will have many more illnesses. Number of illnesses will be more frequent episodes, and few can be more severe also.
Right. And so, since we are seeing, again, a dozen and up students every second day, such reports coming in of those who are testing positive for coronavirus. My next question to you would be regarding inoculation. Do you think it's time that we start thinking of inoculating those below 12 years as well?
Certainly. You see, till now, one thing is absolutely proven, that vaccines have been very safe. You can say they did not work very well against Omicron. At least they did not allow us to get too severely ill. Most of the hospitals these days, there are hardly any 1 or 2 or maybe maximum 10 patients per hospital of COVID these days, which means it's not severe. So severity definitely it has reduced even for Omicron. And number of illnesses, the number of cases also, it is well calculated, that had we not taken the vaccine, and we would have had far larger numbers, which means it protects to some extent, and it is certainly safe. We have not had any big problems with our vaccines. So it is time that we start planning and start executing this plan of offering vaccine to younger children also. We have those vaccines which have been tested. We have data available with the government of India and the recommending agencies. I think it's time that they allow vaccinating younger children also.
Sir, a question or two before we let you go. Now, this is regarding masks. The mask mandate has been removed for adults. Of course, that's because the government wants us to return to normalcy. The cases of COVID certainly reducing. To begin with, it's very difficult, and I'm sure you'd agree to, make children understand the importance of masks, to force them to wear a mask, and especially at a time when adults are not wearing a mask. Children are more vulnerable, as you yourself said. They've not been inoculated. They're meeting each other every day inside of classrooms, eating their lunches together. So they can be a carrier of the virus. What would you suggest, sir, in such a circumstance? Should it be made compulsory for children at least to wear masks inside of classroom? And if yes, can it be implemented?
I've said in your previous programs also that this is a very, very difficult thing to implement.
Yes.
We can't be just theoretical that we should do it. Yes, probably we should do it. But how can you expect a child who's there in the school for 3, 4, 5, 6 hours not to drink water, not to take a small snack in between, and at that time obviously his mask will go out?
Yeah.
Even when they're playing among themselves, chances are mask will at least go below the nose. So all these things have to be accepted, and then only we open our classes. Then only we decide that since the numbers are very low, it looked all right for all schools to open and open fully. It took convincing at, let's say, 2 weeks back. Now that numbers have started rising, it still looks okay because numbers have risen. There is a surge, but it is the expected surge. If it starts going out of hand once again, then we'll have to rethink of our policies. At the moment, it looks that we cannot force children. We can educate them that at least when they're as much as possible, they'll do it. For example, when they visit us in the hospital for whatever reason, they may be coming for just a normal health check or a normal immunization and vaccination. We tell them at least keep wearing a mask. Of course, we are always wearing a mask no matter what. In the hospital, we always wear a mask and an N95 mask, not a usual one also. So that kind of precaution we still need to continue. And due course of time, if things don't go out of hand, numbers don't go very high.
You say things, obviously the next thing you're watching out for is for the number of cases. That fortunately till now, pan-India is pretty low as compared to the last few years. In fact, last 2 years altogether. But when we speak of children specifically, sir, the schools have opened, the cases are on the rise. Any word of advice or caution for the parents and the students who have started attending classes?
Yes, I think advice is not for really healthy children. It's for those who by chance are not well today. Parents' responsibility is not to send the child to the school because any illness can ultimately after 2-3 days may turn out to be a COVID illness. Whether it is a diarrhea or a cough and cold or a fever or any such thing in a child, on testing may be found to be a COVID illness. So any child who's not fully well should not be allowed to go to school, even if it's an exam, because certainly this person is going to spread it to his colleagues, friends. So that's our responsibility as parents.
Right. And sir, as far as the students are concerned, we are speaking of their immunity. the other big issue which we are seeing is also the mental toll, which this pandemic has taken on children. They're going to attend classes after 2 years. Unfortunately, many of them are falling sick within days of attending classes. It is a psychological trauma, for a very younger child. What would you like to say to them today in a difficult circumstance, perhaps like this today, sir?
So psychological trauma of joining the school, well, they have now been to school, and many have almost forgotten what it was, and the youngest of them have never known what a school is. So for them, it is a kind of trauma, but we have to kind of balance it out. If they continue to stay at home and not join the school, is that a worse trauma?
Yes.
Probably yes. So it looks that, yes, we should allow our children to go to school. Maybe they need an extra support from the family and the parents, and the teachers also, and the whole staff in the schools. And I'm sure, in fact, whatever I know of, most schools are coping up very well. In the 2 years that they were not having any physical classes, they have trained themselves very well to look after children who have reached their first day. I know of many children who were so happy on first day, who had never been to a school. First time they were going, and they were happy. So that tells you that they were missing that interaction with their age.
Yes, they have, many of them, you rightly said, have been missing that interaction also. So my last question before we conclude this discussion: the XC variant, we know it has reached India. Anything for us to worry about? Anything for children, school-going children, their parents to worry about? Or or would you say that as of now we just need to hold our horses because again the number of cases minuscule?
Again, the number is not very high, and severity of XC is also not more than the current variants. So I think from that angle, we should not be worried. Yes, it is somewhat more infectious, and more infectivity is what is being told to us by the epidemiologists. So from that angle, yes, a little more precaution. But as far as severity is concerned, it is probably as bad or as good as the previous strains. So we should not worry too much about the XC strain.
All right, nothing to worry about as far as the XC strain is concerned. Wear your masks, take all the precautions, but start going to schools. That really is the message and the word of advice and caution coming from Dr. Chugh here on NewsX. For now, sir, thank you for speaking to us, taking out time to talk to us on Medically Speaking.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.